overnight because it is quite an investment. And this night guard will actually be okay for her for a while. If she starts grinding too much on it, it will eventually break. It will eventually wear down, so it's not going to be a permanent solution to her at all. It's not going to be the best custom fit. However, it is going to give her a little bit of break from wearing her teeth down. She has some inlays and onlays in her mouth. Oh, you might want to take a look at that. So, okay. That are getting kind of shiny, and that means that they're rubbing all the time, so they're just smoothing right on out. The occlusal surfaces are kind of getting a little bit flattened, and so then that's what's causing the doctor to recommend her getting a night guard. So we're lucky that she's going to allow us to do a temp night guard, and you guys get to see a live impression on her. So you guys already have the impression stuff together. I'll only talk about a few little things as I'm mixing and placing. When I get ready to start placing it in her mouth, however, you're probably going to want to come in on this side and get a view of her that way. So we've already washed. My mask is going to be down a little bit, Mary Ellen, just so that they can hear me talk.
Okay.
Normally, you know, I'd have it all the way up and over.
No problem.
So we did 3 scoops for Mary Ellen, and I have 3 different size trays here because I'm not quite sure what size her mouth is. So before you even get going with mixing, the first thing you want to do is to look inside the patient's mouth. The sizes that I picked are pretty much the standard sizes for for women. So you want to be able to lift the patient's chair.
It's small.
It is. She has a very small mouth. So go ahead and lay your head back there. Yep, she is small. So let's see what size I have here. I have a 4. I might need a 5. Can somebody grab me a 5 tray in the lab area? We're gonna try it in the 4s, but grab a 5 just in case it doesn't fit. And in trying in the trays, you guys can step around here. This is gonna be pretty important to watch and see. So in trying on the trays, again, I had her to open her mouth there just so that I can kind of take a look. What kind of crowns are these right here, ladies? Crowns. What kind of crowns are these? FGC stands for? Fogo crown. Nope, if you turn your head this way, it looks gold.
Oh, maybe the light. I don't know. It looks so.
Yep, nope, it's gold. And so open, and then if you take a look in here, that is a gold inlay inside of her mouth. So it looks like a filling, but it's actually part of a gold crown that's formed to look like a filling. So go ahead and turn back towards me. Perfect. So the first thing I do is I'm going to try this 4. If you look inside, she has a little bit of lingual tori on the bottom part. So remember, we're talking about those bony protrusions that are there. So that can be an issue with taking these impressions as well, because if this tray is a little bit too narrow or hitting down into that bony area, it's going to hurt the patient. So then what we'll end up doing is getting some red wax rope to take the impression. But we'll try it first. So what I do is have my patient go ahead and open lazily without stretching the mouth too much. And the reason why you do that is because you're going to be able to get into the mouth a lot easier. If you stretch your mouth really wide for me, if they do that thinking that they're helping you, it's not much more room to work in there. And these trays are fairly big. So again, we're just going to relax the cheeks. And what I do is I pull here, and then I take the side of my tray, and as I bring it in there, I start to retract. Now what I do is slowly look in the back and see if I can get it all the way over. Lift your tongue for me. Good. And so this is too big. So I can tell that it's too big because I'm not able to bring it all the way down and around, right? So now we're going to go to a different size there. But that's how you kind of get it in and out of the mouth. Okay, so that one's not going to work. Now the upper one might work, it might not. So we won't take everything and start putting it away quite yet. So where do we put our 5?
Yeah.
Right here. All right, so let's take a look at 5 and see if 5 works. Okay, lazily open, relax, perfect. And look your tongue. Oh yeah, that's a better fit for her. So here, it goes into the mouth and it fits over the teeth without being too big or too small. And then, go go ahead and slide that up. And I always kind of wrap around just in case there's any ropey saliva so that it doesn't drip all over the patient's face, right? So we're going to put this to the side because we know for sure that we're going to use that. And now I'm going to take a look at the upper. And I'm gonna try the 4. Her upper jaw looks a little bit bigger than the lower. And so we might can make the 4 work. So again, very lazily, relaxed, sliding it in this way. And I lied. So, now the upper one is important to be really careful on. So let someone get me a 6. Relax just a little bit more. Yeah, this one's gonna be a little too wide for her as well. You don't want to keep stretching your patient out though. Okay, so we'll just wait a little bit. Can you glove up and get me a little bit of a moisturizer for her lips too? You're not recording now, are you? While we're waiting? Perfect.